Hello, my name is Nurse Brown, and I will be doing a full assessment on you today. Can you state your name and date of birth for me? All right. And have you been having any chest pains or shortness of breath?
No.
All right. I would like to check your respirations. Alrighty, your respirations was 14 breaths per minute. And now I would like to listen to your lungs. I will start in the right upper lobe. Can you take a deep breath in and out? Alright, now I'm going to listen to the left upper lobe. And now the right lower lobe, the left lower lobe. And the right middle lobe. I'll listen to the right lower lobe. And then the left lower lobe. I will also listen to the posterior side, starting with the right upper lobe. Could you breathe in and out for me? Now the left upper lobe, in and out. Left lower lobe. And right lower lobe. All right. Now I'm going to ask you to tilt your head back for me to check for any jugular venous distension, none present, and I will also check your radial pulse bilaterally. All right, and then I'll check your dorsalis pedis bilaterally, and also the posterior tibial bilaterally. I'll also check for any edema in the upper extremities. And also check for edema in the lower extremities. Also check for capillary refill in the upper extremities and also in the lower extremities. And now I would like to listen to your heart. Starting with the aortic area on the right side. Second intercostal, then moving over to the left side. Pulmonic area, moving down to the third intercostal, Erb's point, moving down to the fourth intercostal, tricuspid valve, and moving down to the fifth intercostal, lining up with the mid-clavicle line, listening to the apical pulse for a full minute. All righty. And now I would like to ask you a couple questions. Have you been having any types of headaches?
No.
No types of headaches. So I would check for facial symmetry and just feel around the head. And then I would ask you, do you have any hearing impairment or hearing problems? And now I will perform a test and you just state if you hear it. All right, we'll go to the other side. And you basically just state if you hear it or not. Alrighty. And now we'll move on to vision. Do you have any vision problems or blurriness? Alrighty. What I'm gonna do is ask you to stare at my finger. I'm gonna move it from side to side, checking the left eye, and then also checking the right eye. And then I'll also ask you to stare at the pen, and then move back. Alrighty. Now, have you been having any types of nosebleeds or stuffiness? I'm gonna ask you to perform a nostril patency test, which you'll place your index finger on one of your nostrils and inhale in through the other, and do the same for the other. All right. righty, and I will ask you, have you been having any dry mouth or sore throat?
No.
Okay, I'm gonna ask you to open your mouth and say ah, checking for any abnormal signs. All right. And now I will ask you I'm going to perform the musculoskeletal, starting with the neck. I'm going to ask you to tilt your head up, which is hyperextension, and then look down, which is flexion, and then you're going to touch your ear to your shoulder, which is lateral flexion, and to the other side, lateral flexion and rotation. You'll rotate to the right for lateral rotation and rotate the left for lateral rotation. I'll also be checking the wrist. You're going to point up, which is hyperextension, and then go lay it out, which is extension, and down, flexion. And then what you're going to do, place it back up and move out, which is abduction, then move back in, which is adduction. Now I'll also perform it on the other side. Move it up, down, back up, then side to side. Alrighty. Now we're going to do the knee joint. What I'm going to ask you to do is kick your knee out for me, which is hyperextension. Alrighty, you can put it back down. This is extension of the knee. Then I'm going to ask you to kick this one out and then place it back down, which is hyperextension, then extension. Then I'm going to ask you to stand up. And now what you're going to do is you're going to place one leg up, which is flexion of the knee joint, and also on this side, which is flexion of the knee joint. And now I'll ask you to do, you can stay standing. We're going to assess the hip joint. You can face this way. And right now, I'm going to ask you to do is put this leg up like you're marching. All right, and then I'm going to ask you to kick back for me. All right, and then I'm going to ask you to place your foot out to the side. All right, and you'll do it on this side. Just that's abduction, and then you're going to place it up like you're marching, and then you're going to kick it out back. Hyperextension. All right, now I'm going to ask you to take a walk from that wall back, a normal walk. This is the gait test. And then I'm going to ask you to do a heel to toe. Trying to walk in a straight line to the best of your ability. And then I'm going to ask you to stand here. We're going to do the Romberg test check. You're going to just stand still and close your eyes. All right, you may sit down. Now I would like to go over now I'm going to be doing a neurological assessment. Do you know where you are right now?
Yep.
Can you state that for me?
In the library. Copy.
All right, and do you know your date of birth and age?
Yes.
And your name?
Yes.
Can you state that for me?
Ali, September 8th, 1999.
All right, and do you know why you're here?
Yep.
Why you're here?
Just helping a friend.
All right. And do you know what year it is?
2000. Not 2022.
All right. And now I'm going to go over the Glasgow scale, which is a scale used to measure a person's level of consciousness when they had a recent brain injury. Okay, now we're going to go over safety precautions and measures, such as making sure you have your car light with you or cell phone on you in case of emergency, making sure that the light is visible for your seeing when walking around, and also making sure there's no clutterness or anything in your way when you're moving. Also making sure that you have on grip socks to lessen the risk of falls, and also making sure that we as nurses are on hourly roundings. And now I would like to ask you a couple questions involving fall risk. Now, have you had any falls within the past 3 months?
No.
No falls. And any diagnosis that I might need to be aware of? Okay, and do you use any type of assistance when moving around, such as a crutch, cane, or any type of furniture? No. And what about, do you feel weak or impaired to where you can't move at all when you're walking?
Nope.
Alrighty. And I would also like to do the gastrointestinal assessment. my light pen. So what I'm gonna do is find your belly button area, and I'm going to oscillate in the right lower quadrant of the belly, and then I'm going to listen to it for a full minute. Now I'm going to do the right upper quadrant for a full minute. Now I'm going to do the left upper quadrant for a full minute. And then the left lower quadrant for a full minute. Alrighty. And then I would like to do the bruit. I'm going to check the bruit for any adventitious sounds. Alrighty. Alright, I check for sounds. And you haven't had any types of headaches or neck pain, none of that? Okay, and any type of abdominal pain that I might need to be aware of? And no type of urinary infections or urinary problems that I might need to be aware of?